If using the Transcend device for multiple patients, perform the following steps to clean the device before reuse. Note that all components of the air circuit, patient interface, and filters are single patient use only. Do not attempt to clean or sterilize these for multiple users. Begin the cleaning process by unplugging power. Remove and discard the air circuit and patient interface. Then, take an appropriate disinfecting wipe and clean the outside of the device. Do not submerge or allow liquids to enter the device while cleaning. Finally, remove and discard the inlet filter assembly. Discard all parts according to standard biohazard procedures to avoid cross-contamination. To set up the device for use with another patient, replace the mask, air circuit, and all filters with new components. Note that the BiPAP should be recalibrated each time with a new respiratory circuit. After completing this process, the device is ready for reuse.